So emergency delivery for emergency physicians. What we need to know. So in general, I will let you read up on the theory about this. Now I'll just go through the practicalities. So there's the entire thing about examination and seeing how open a patient is something that I'll let you read up on by yourself. But usually when the patient has no cervix left and they are open 10 centimeters and it's totally soft, then they're ready to, and they usually feel pressure downwards and the baby is beyond these spina taps. I can't remember the English name, but these taps here. Then usually they're ready to begin the last phase, where they push. And anecdotally, when they throw up or when they are really in pain, then that's usually when they're at this point. So when you know when to push, well, those are some of the criteria, and then usually they feel a pressure downwards, and you can see the baby is right at the like you can see the top of the head here at the vaginal opening. Okay, so here up until now, what is most important is to prepare the woman for how to do these pushes. The pushes before they when they begin the push phase. The pushes are every time they feel a contraction, then you'll put their chin to their thorax like this, and then you'll take a deep breath and then push. Don't scream, just push. And I know it's hard, but and then you'll in between when they have contractions, then you'll as an helper you'll try to make them calm, try to remind them that they need to relax their muscles and keep their breathing in a controlled manner, and so on and so forth. And these are really important things about the delivery. But so that's why I'm mentioning them here. But when it comes to the very last phase, when they have been pushing for, you want the baby, you want them to push maximally maybe an hour. And if it's a first time pregnant, first time vaginal delivery, then it may take a bit longer, as long as the baby is doing fine. And sometimes you can prolong this, but that's usually with CVG monitoring and so on. But let's see you're in the parking lot and you need to deliver this baby. Then usually what happens is, and this model is a bit too male-sized, so well, I'll try. All right, so the baby is standing here, and once you in the last phase of the pushing phase, you will see the head coming out. And once you see the head coming out, then you will try to move your fingers up here behind to see that there's no umbilical cord. If there is an umbilical cord, then you'll try to get it and then push it out the way over gently, because it may break. Okay. Then as the baby, and here is really important to communicate with the mom, because this is where we are about to see that they don't have to push anymore. So the pelvis and the soft tissue here is most stretched when the head is coming out at the largest diameter, and when the shoulders are coming out. And these are the highest risks of getting a tear when these come out. So once the baby is before, once they're crowning, but they're not at the maximal diameter, you'll have a towel, a hot towel, maybe lukewarm, a bit warmer than lukewarm, and then you'll put it in the perineum, and you'll push it upwards. And with your other hand, I cannot show you with both hands, but you have this hand the entire time until the baby is out, and with your other hand you will guide the head. You have this is what you call the speed hand in Swedish. You'll like hold your fingers here, and then you'll guide the head, and the movement that the baby has to make from here is turning like that when it comes out like that, and then it'll come out. But before then, when there's as much pressure as there is on the soft tissue, so this is when you don't want the mama to push. So you'll say once you're holding the perineum here, you are very ready. You are really intense in your communication with the mom, and you've prepared her for this. Now I'm going to be intense in my communication. You need to listen to me and only me, and no one should tell them to push but you. So usually you'll have to say them at this point. Let's just breathe through your up until now. In the push phase, you have pushed every time, but now you have to breathe through, and it's really painful because it's hurting down here, and you just want to push, but you should not push because then there's a higher risk for tears. And the bigger tears I've seen is usually when this communication is not going well, because of psychiatric reasons or because of stress or anxiety or so on. Right, so the baby's crowning here. You look here, and you're maintaining your perineal protection here, and then and if there's no umbilical cord, then you'll just have perineal here, perineal protection here, in and out, in and up, and you will hold the other hand with your speed hand, just gently pushing on the baby's head, for not so that it doesn't go out too fast. Once the baby comes over the symphysis, it can go really fast, and what happens is it will turn, and once it turns, then you'll, with both hands, now I can only show them with one hand, but with both hands, first you'll deliver the anterior shoulder here, and once you can just see the anterior shoulder out, then you will not push down anymore. So this is like push gently down with hands, one flat hand on both of baby's head, and push gently down. And once the anterior shoulder has been it comes into view, then you'll with the same grip, you'll push upwards. And it's really important to push upwards all the way while you're maintaining a perineal protection, either you or someone else at this point, because it's hard with two hands to do that, because this is where the mama can tear downwards as well if you don't do this. So then you pull up, and then the baby is delivered. And you do not clamp the cord until 60 to 90 seconds after, or more, as long as if the baby is doing well, then just keep it here. And then lay the baby on mama's chest, skin to skin, very important, skin to skin. And then dry them with a towel, and just let them lie there with a dry towel on the backside, and then on the stomach they'll have skin to skin, and lay them on the chest so that they'll go through usually 9, sometimes not always, but 9 steps. Usually they'll be active for a few minutes, then they'll be quiet, and then they'll wake up and want to feed, and they will like suckle, and at that time, after maybe 5 or 10 minutes, then they will want to suck on the breasts. Okay, so just to recap, when it comes out, then you look over here, see if there's any. Sorry, in the pushing phase, they push with their head like this, and sometimes, and this is where the midwives are experts, right? So, but with your legs in an extended flex position sometimes, and then just push. And then all the pain management in between the pushes is really important, and so on. But you'll have to read up on that yourself. Okay, then once the pushing phase comes to the last bit of the phase, then the baby's almost out. It is crowning. You can see the skin is tightening. Then that's when you use and maybe a bit before that, then you do your perineal protection, where you push in and up, and keep that and use a towel, a hot towel for that, and then the baby will come out. It will come out. Oh, sorry, come out like this. And once it comes out, and you can get your fingers above here, you'll see if there's any umbilical cord. All right, and then before this, you told the mother to just breathe through the contractions. Don't push, and the only way maybe you can do a little small push if it's head on your hands. Yeah. All right.